So good evening, good morning, good afternoon, ladies and gentlemen. Welcome to our today's webinar, ISSUP Kenya's webinar. ISSUP is a society of different memberships that come together to address the issue of drug and substance abuse at various professional levels in prevention, treatment, as well as recovery support. And today, ISSUP Kenyan chapter is delighted to be presenting to you Managing Substance Use in the Workplace. I'm your today's moderator, Catherine Muthiani. Before we begin the webinar, I need to let you know that this meeting is being recorded. After the recording, after the webinar, you'll be able to access the recording at ISSUP YouTube channel, as well as the website together with the presentations. You will also be able to get a certificate at the end that will be emailed to your emails. In case you want to interact with us, write questions on the question box that you can see on your screens, and your questions will be responded to after the presenter is done with her presentation. Our presenter today is Dr. Florence Jaguga, who is the chairperson, Employee Assistance Program at the Moi Teaching and Referral Hospital, a consultant psychiatrist at the same hospital, and the head chair, the Department of Alcohol and Drug Abuse at the Moi Teaching and Referral Hospital. Need I say that she's joining us not from Nairobi, which is the usual place where the Kenyan webinars are presented from, but from Eldoret, the world of champions, where we get to get the best of the world athletes. Welcome, Dr. Florence.
Thank you so much, Catherine, for the kind introduction. I'll be taking us today through, just a second, I don't know why it does disappear. Okay, Catherine, just to confirm, can you see my screen well? Catherine, can you see me?
Yes, I can see you. I can see your screen. You can proceed.
Okay, fine. So thank you so much, Catherine, for the kind introduction. Participants, thank you so much for attending this webinar today. And we'll be talking about how to manage substance use or alcohol and drug abuse, if you will, in the workplace. So we are going to look at how big the problem of substance use is among employees, and then we'll look at some of the risk factors that are associated with employee substance use. After which we'll look at why it's important to address substance use problems in the workplace, and then we'll look at employee assistance programs, which are a mechanism for addressing substance use among employees. So a couple of studies have been done, even though there's not too much literature out there. A couple of studies have been done to evaluate the burden of substance use among employees. In the US, a study done a couple of years ago found that about 14% of employed adults were engaged in illicit drug use. Again, another study in the US found that about 9% of employees had used alcohol heavily. Again, about 9% had used illicit drugs, and about 10% had a substance use disorder. So this study was done across different employees in different sectors in the US. So we can see how substantial it is, about 10% for each of these categories. And that study found that some of the highest rates of substance use were within the mining sector, construction, but also accommodations and and food services industry, where we can see the rates were as high as 20% for illicit drug use and about 17% for substance use disorders. Okay. One study conducted in Sweden tested the urine of employees and found that about 6% of them, tested positive for illicit drug use. So that really means that there was recent illicit drug use among about 6% of employees from that study. In South Africa, they compiled data sets from various EAPs across the country, EAP's Employee Assistance Program, and they found that of those who sought assistance with this program, 65% had reported problems related to alcohol and 35% drug-related problems. So we can see that, substance use is a major reason why employees seek for help from the employee assistance programs. So a study done in Kenya by the National Authority Against Alcohol and Drug Abuse found that about half of public officers had ever drunk alcohol, 23% had used tobacco, 16% had chewed cat. For those outside of East Africa, cat is a green leafy plant whose leaves are chewed, and the leaves contain methamphetamine-like substance, which is like a stimulant. And then about 6% had used bang and 1.3% other drugs. So really what we are seeing from this, data is that substance use is very prevalent, very common among people in the workforce, people who are employed, people who are working. There's a huge burden of substance use in that population. Okay. Good. So a lot of these studies have also explored the risk factors for employee substance use. And consistently, we see that males are at higher risk. A lot of studies show that substance use is associated with being male. And that is seen among employees and among various other populations across the world. Of course, that is gradually changing, but this is what it is right now. Also, coworker use, that if people have a coworker who's using substances, then that is associated with substance use by an employee. Availability of substances in the workplace, quite interesting that in some workplaces, actually substances are available, and that is predisposing to substance use by employees. Social isolation, usually, for example, being unmarried or separated or widowed or divorced or single is associated with substance use in many populations, but we see that among employees as well. Permissive drinking norms, that means that within an organization or within a society, the community from which the employees come from, if the culture permits substance use or alcohol use, then that predisposes to employee substance use. And so we are going to look at how we can discourage substance use in the workplace, for example, by not permitting substance use in events in the workplace. Also, lower supervisor ability to handle substance use problems. So that predisposes to employee substance use. So again, we are going to look at how we can strengthen the capacity of supervisors to handle, alcohol and drug abuse problems at work. Of course, greater exposure to job hazards. For example, within a healthcare setting, because I'm a healthcare worker, so I'll give that example. It can be stressful with high workload, lots of patients to be seen, watching a lot of pain and suffering every day. So that psychological distress is a job hazard. So greater exposure to job hazards, working shifts, for example, can be a risk factor for employee substance use. And of course, lower levels of coworker interactions, that goes hand in hand with social isolation. So why should we care about substance use among employees in the workplace. Why should it be something that concerns us? Why should we pay attention to it? Why is it important? So it's important because first and foremost, employees are human beings, and human beings are deserving of good health, good physical health, and good mental health. But an alcohol and drug abuse takes away that. We do know that alcohol and drug use is a risk factor for several health conditions of the heart, conditions of the digestive system, multiple cancers, falls and injuries, road traffic accidents, and we've seen in many reports that have been published by WHO, the global status on alcohol and drug health, reports by UNODC, we do see consistently that alcohol and drug use are risk factors for various health conditions. But not just physical, alcohol and drug use also contribute to a lot of mental health issues. For example, I do see in the course of my work a lot of, psychosis related to cannabis use, a lot of suicidality related to cannabis use, depression related to alcohol use and cannabis use. I see psychosis related to cat use. I said cat is a stimulant found in East Africa. So a lot of anxiety, again, related to cannabis. Actually, I see a lot of psychopathology that's related to cannabis use in the course of the work that I do. Okay, so it's not just the health of the individual that is affected. It affects the entire society as well, and also affects other aspects of the individual, like, socioeconomically. So the cost of alcohol and drug use is quite heavy. So there's increased risk of, we see a lot of interpersonal violence, gender-based and of course non-gender-based violence. We see a lot of social dysfunction, job loss, marital strife, difficulties in relationships with family members, quite a lot of dysfunction socially. But it's also costly to the society. Okay, so when someone is heavily using alcohol and drugs and they are not able to contribute, they're not able to work, they are not productive, that is costly to the society in terms of lost income. And there's also costs that are, incurred because of, the health conditions that emanate from alcohol and drug abuse. So it's quite costly. So in Kenya, we did a study about 2 years ago, and we found that alcohol use disorder, this is just alcohol, fosters 3 billion shillings due to lost productivity and premature death. This is money that could go to better use in some other, in some other development issue, for example, in the country. So it's quite costly, it's quite heavy. The impact goes beyond the individual. Okay, but now relevant for today's discussion, alcohol and drug abuse affects organizations, and we know that employees are a critical resource for organizations. Employees are there so that they're able to fulfill the mandate of the organization. They're able to be productive to meet the objectives that have been set forth by the organization. So organizations should care about employee alcohol and drug abuse, because if they don't, then they lose an important resource of theirs. And also because alcohol and drug abuse poses very significant safety risks in the workplace. So you can imagine, we saw in the US that the high rates of alcohol and drug use was mining and construction. And you can imagine the kinds of accidents that can happen within that sector when there is intoxication or when an employee is experiencing withdrawal. You can imagine the accidents that could happen. Or even in a healthcare setting, you can imagine the safety issues that could happen, like medication errors, for example. So employers should care because it also poses safety issues within the workplace. Okay. So what barriers do employees face in accessing treatment? And I realized when I came up with this slide, my mind was very, I was expressing what actually happens in my setting in Kenya, that we do have multiple barriers to accessing treatment for alcohol and drug use. It may not be the same thing everywhere in the world, but in many low and middle income countries, in Africa, also here where I live and work, the services for treatment are very scarce. And then there's a lot of stigma and discrimination, and many organizations don't have, the tools to manage alcohol and drug abuse in the workplace. The mechanisms have not been set, the interventions have not been established and set forth for employees. So there's a couple of barriers that employees will face. And I believe that in many parts of the world, this constitute barriers to accessing care. So what can be done to manage alcohol and drug use in the workplace? What can we do? And I think the first thing I'd like to say is that the workplace is a good place to intervene for alcohol and drug use problems, because it's where people spend a majority of their time. Okay, if you think about employees, largely they walk in at 8 o'clock, they leave at 5. Even if it's a night shift, then it's still another whole 12 hours or more of being in the workplace. So a lot of our adult life is spent in the workplace. So that's a good place to integrate and implement interventions for alcohol and drug use. Okay. So I'm going to talk about employee assistance program, which is a mechanism for addressing alcohol and drug use problems in the workplace. The history of EAP is quite interesting. They were started about maybe 100 or so years ago, mostly in the US, a little bit in Europe, and largely to address alcohol and drug abuse problems. Of course, they've grown over time to include other mental health interventions or other interventions for, psychosocial support. But the initial history for EAPs was that they were started to address alcohol and drug abuse problems. So what's an EAP? As I said, it's a program for supporting staff psychosocial issues that impact workplace performance. And the role is really to support employee wellness, improve productivity, and serve as a risk management tool. So you can see the role of employee assistance program is twofold: support the employees' wellness, but on the other hand, safeguard this very much needed resource for the organization. So they serve both interests of the organization as well as the interest of the employee. So it's twofold. And the International Labour Organization recommends that employees or employers implement EAPs in their workplaces. Okay. So what is needed to implement an EAP program? What are the things that go into having an EAP program? So you do need a committee or a coordinating body or an oversight, team, whatever you call it. Here we call it an EAP committee. You do need a policy, a document that guides on how you implement your activities. It should be clearly spelled out. And then you need a series of programs or interventions that are being implemented to address alcohol and drug abuse, and of course, a work plan and a budget. So very simple, very easy to constitute. I was talking to a friend today. She has an EAP in an organization. not mine, and she was having challenges with how to set it up. But it's quite practical and easy. Of course, a lot of advocacy needs to be done, because you need buy-in from senior management, for example, and there needs to be a lot of education of senior management for them to understand how important it is to address alcohol and drug abuse in the workplace. But once that foundation work is done, then it's easy to implement the program. So the role of the EAP committee is to plan the activities within an organization or institution, to coordinate EAP activities, and provide general oversight. So almost like a governing function. And then also they have the role of establishing EAP services, you know, making decisions about what kinds of services to offer within the organization, what kinds of services will be outsourced, okay? And generally we do encourage that, you know, services focus on both mental health in general and alcohol and drug abuse, just because those two things happen together. And often the EAP committee would work very closely with management within the organization. But of course, the EAP serves as an advocate, you know, advocate for employees' rights to treatment, you know, advocating for taking us, you know, for alcohol and drug abuse to be seen as a health issue rather than a disciplinary issue, for example. So there's that advocacy role as well that's played by EAP committees. And generally, membership can be varied. If you look at the ILO guidelines for how to constitute a committee, they do recommend a host of, you know, people who should, you know, sit in the committee. But then you could have mental health professionals, people from human resource, representative of occupational health and safety, workers union representatives, people in recovery, and so on and so forth, just depending on what the unique needs are for your organization. But generally, these are the kinds of people that you would want to be on the committee. And when I say mental health professionals, you know, they also have expertise with alcohol and drug use. And then you need an EAP policy. So basically a set of guidelines for how you want to run the program, you know, within your organization. Okay. And, you know, key content that you need to talk about prohibition of use in the workplace. I think that's the general agreed stance to take, that substance use is prohibited in the workplace. I doubt that there would be, you know, an employer or an organization that would encourage substance use while at work. So the general, you know, consensus is that substance use is prohibited in the workplace. The policy also provides guidelines on the treatment and prevention programs to be implemented. What do they look like? Is it health education? Is it an outpatient service? Is it referral for specialist inpatient care, and so on and so forth. Also key that I find particularly important is to have a section that talks about intoxication in the workplace and drug testing. This can be quite controversial. You know, from my own experience, I find that intoxication in the workplace poses a lot of safety risks, and we have seen it, you know, very significant accidents happening because of intoxication at work, or potential errors happening. And you can imagine what implications it could have. For example, I work in the health sector. So you should have clear guidelines for how to handle intoxication in the workplace. What happens to someone who's intoxicated? Do you allow them to continue working? Do you remove them from the workplace? Do you allow them to go home? Do you take care of them until they recover? Do you conduct testing? Should there be consent for testing? Should testing be mandated? What are done with the test results? What is the purpose of testing? So it's really important to think about and agree as a committee how intoxication and drug testing will be handled. Of course, in certain organizations or with certain occupations, random testing is mandated and done. In some it's only done when it's indicated, but really depends on the unique needs of each employer. Also, human resource issues are important, surrounding job security. If someone shows up and says, hey, I have an alcohol and drug abuse problem, will they be promoted next time they are due for a promotion? Okay, you need to think about disciplinary action. What is the role of disciplinary action in alcohol and drug abuse issues? We cannot run away from it. And also the ILO guidelines pronounces itself on this matter. We are going to look at that later. And also issues around determination of fitness to work. What happens when an employee has gone to treatment for alcohol and drug abuse and still, recovery is not forthcoming? What happens? Okay. So very tricky issues, no straightforward answer, but it depends on the unique needs of the institution, but also what local legislation says about alcohol and drug abuse. And also it's important within the policy to highlight the various roles and responsibilities of employers and employees. What is expected of an employee? For example, for an employee, there'd be the expectation that they adhere with the treatment that has been prescribed for them, or they cooperate with random drug testing, for example, and the employer is, mandated to give time off to attend treatment. So those have to be defined within the policy. Thank you. So what kinds of programs can EAPs implement? So generally, you're looking at preventive programs, programs focusing on preventing alcohol and drug use, either initiation or progression, to harmful use, or you're looking at programs that, handle treatment for those who have a substance use disorder. Okay, so important to have regular education of staff, on substance use and its harms, but also important to debunk certain myths about substance use and also to destigmatize. So we find a lot of discrimination and destigmatizing attitudes for alcohol and drug abuse among employees, and which really constitutes a barrier to care. So it's really important to continuously educate staff on the fact that people with alcohol and drug abuse are in need of treatment. Also general education on how to promote mental health, because we know that there's a strong link between poor mental health and alcohol and drug use. Okay, generally poor coping skills, poor coping with stress can lead to harmful alcohol and drug use. So we do that kind of education. And then we also educate on other general areas that would promote mental wellness, like how to manage finances. We see a lot of alcohol and drug use related to heavy loans or getting into debt. So we do education programs on managing finances, and also managing conflict at home, managing conflict in the workplace. So very broad program that focuses on mental wellness with the goal of reducing harmful. Okay, and it's also important to think about taking it early and referral for appropriate care. And here you really do need the support of supervisors, particularly in a large institution. As an EAP committee, you may not be aware of all the challenges within the organization that are happening. You may not be aware that person X has showed up to work smelling of alcohol, or is, holed up in the office smoking cigarettes. You'd rely on colleagues and supervisors to pick that early and refer to the employee assistance program. So we do encourage supervisors and colleagues to come forth and share if they have a colleague who is struggling. But of course, after referral, then you need to do your assessment and then send for appropriate care. Okay, so other programs that can be implemented, you can implement testing. I talked about that at length. Other staff support interventions, like recommending reassignment of duties. If a staff was in a place where opioids were accessible, I give examples that, are relevant for my work setting. So if a staff was in a place where opioids, pethidine, morphine is available, and that was what was being abused, then you can reconsider reassigning duties to a place that, really they wouldn't get access to that drug. So that in addition to treatment, you're also thinking about the environment. How do you reorganize the environment? We've done financial support before. We had a staff who, because of alcohol and drug use, really didn't have much at home. Really, there was not much. And through the corporate social responsibility aspect, of our organization, we were able to get funding and, get this person a house, buy basic household, goods and kickstart their life after inpatient rehabilitation treatments. So all of these social supports are extremely important. Remember, alcohol and drug use is a very complex problem that is multifaceted, and a lot of social factors, that contribute. So it's good to look at an individual holistically. It's okay to do the psychotherapy, but it's also good to think about, so when I'm done with this psychotherapy, where does this stuff go to at home? So important to implement those kinds of support interventions. But then, of course, the more formal mental health care can also be implemented by EAPs. And we are fortunate within the setting that I work to have a mental health department. So it's easy to have the staff within that department deliver psychotherapy and also deliver psychiatric care, because we do have psychiatrists in the institution. But then I also acknowledge that many organizations don't have that within their institutions, so they could outsource, and refer, connect staff who are struggling with services that are within, the vicinity of the institution. So it mustn't be right inside the institution. If you can employ a psychologist, fair enough, a psychiatrist, fair enough, but many times that is not possible. But then there's that option of, referring them to a mental health service that's nearby. Okay. A bit of repeating there. And then one important thing is training of supervisors on how to manage alcohol, and drug use in the workplace. Extremely important, because the EAP committee usually has a membership of about maybe 10, 12 people. And they're not able to go around identifying everyone. They do a lot of coordinating work. Mostly they have other duties as well assigned to them. So you really bank on supervisors to identify people who are struggling and to support them and refer them for treatment. And then it's also important to train them, so and senior management as well, so that alcohol and drug abuse problems are destigmatized and people are referred for treatment rather than, disciplinary action instituted. Okay. So other activities that can be done, you can do surveys to determine the burden of alcohol and drug abuse in your institution, because that provides evidence against which you can, advocate for allocation of a budget, or you can advocate for setting up of an EAP program. But there has to be some kind of evidence. Management responds to some kind of evidence. Also, surveys are done to get feedback on what you're implementing as a committee. Is it going well? Do they like it? Is it stigmatizing? What's happening? So that you can improve your service. Okay. Important to have an annual work plan. Important to plan activities for the year, quarterly, half year, just depending on what works for your organization. In many institutions, budgets are allocated for that financial year. So then it would be good to have an annual work plan, and then it's good to have reporting mechanisms. The management needs to know the activities that are happening, evaluate them, and then so that again helps with allocation of a budget the following year, or even with just support from senior management. So there has to be some level of communication with management to understand what's happening with the employee assistance program. So do not be detached, because you really do rely on senior management to support your activities. Okay. We're almost coming to the end. It's important to advocate for workplaces that are pro-abstinence. So workplaces that, discourage the use of alcohol and drug use, or prevent the use of alcohol and drug use, okay? So the workplace should be supportive of staff mental health, okay? And we achieve that through education, through being understanding, and through even just understanding that alcohol and drug use is a health problem, that mental disorders are a health problem. Extremely important. It takes a couple of years to turn the attitude around, but it can be done. We should encourage fairness and respect in the workplace. We should make sure that employees' roles and responsibilities are clearly communicated. A lot of times there's distress from employees, and I do see employees come to me and say they don't quite understand what they're supposed to be doing. It's distressing, or they've been assigned a role that they don't know how to, they can't figure out how to implement it. Okay. So roles should fit with employees' competencies. Work well done should be rewarded in a timely and fair manner. Employees should be involved in decision making. Work schedules should be favorable. You cannot work 24 hours. You need some time to rest. You need some time to balance between work and life. So what we're saying in a nutshell is that the work environment generally should be pro wellness, pro good mental health, and should discourage alcohol and drug use. So this is controversial. This is what ILO says, and I'll read it aloud. It says, in its guidelines, it should be recognized that an employer has authority to discipline workers for employment-related misconduct associated with alcohol and drugs. However, counseling, treatment, and rehabilitation should be preferred to disciplinary action. Should a worker fail to cooperate fully with the treatment program, the employer may take disciplinary action as considered appropriate. Okay, so these are ILO guidelines from 1996. Maybe the thinking has changed, maybe it hasn't, but we do see that there's a role for disciplinary action, and mostly because from my experience, unfortunately, alcohol and drug abuse issues are often interlinked with disciplinary issues. So what we do prefer in my institution is definitely refer to EAP, but that doesn't stop some kind of disciplinary action to take place. But also, whenever disciplinary action has taken place, we've also advocated for that disciplinary action to be lifted. So we do play that advocacy role. Of course, as research is done and there's more experience with EAPs, then of course, the guidelines on how to handle this a bit, could change. So I feel that it's still a work in progress, and there's no right answer. But definitely precedence is given to managing it as a health condition, but then there are instances where disciplinary action could come in as well. So in summary, we've seen that alcohol and drug use is common among employees. Just as we find it in the general population, we also find it among employees, and the workplace presents an opportune place to intervene. And that addressing substance use has benefits for two people, for the employee, but also for the employer. Okay. So going forward, looking at the literature, there wasn't too much about too much data on the burden of substance use among employees globally. It wasn't that much. In Africa, there was very little. So it's important to conduct that research, because then that provides evidence against which you can you can make a justification for interventions. Also important for organizations to come together in a forum to talk about, to share experiences and share strategies that work. And then it's important to develop and test workplace interventions. Again, if you look at the literature out there, there's not too much about developing and testing interventions for substance abuse in the workplace, and again, particularly for Africa. So we have our job cut out for us. A couple of references. Thank you so much for listening. I will hand it back to Catherine for discussion and Q&A session.
Thank you. Thank you very much, Dr. Florence, for that insightful presentation on managing drug and substance abuse at the workplace. Some engagement in the questions coming in, people appreciating your presentation. If I was to take one of the questions from Dr. Pamela, that is ISSUP Kenya's president. And the question is, you have shown us that some of the guidelines in setting up an EAP program to address issue of drug and substance abuse is come up with a committee. She's asking what knowledge and skills can be recommended in order for this committee to be effective in implementation of SUD management programs at the workplace.
Okay. So thank you so much, President.
Should I pick a couple of questions, then you answer, or you'll be able to answer one by one?
Let me answer one by one so that I'm comprehensive. That way I don't forget.
All right, great. Over to you.
Okay. Okay, let's do that. I'll try to also keep it brief. Thank you so much, Madam President, for that question. A varied range of competencies are needed. That is why when you look at the composition of the committee, we need mental health professionals. You need a psychiatrist, psychologist, if possible. I also do recognize that in many institutions, you may not have a psychiatrist. I work in a healthcare setting, so we are fortunate to have a psychiatrist. But generally, you need someone with mental health training. It could be an addiction professional, it could be a psychologist, it could be a counselor, whatever that is. And then you do need a social worker, for example, that would help with supporting the social aspects. You heard me talk about a staff who we supported who had significant social issues. So we had to pay a home visit, do a social assessment, and then make a case for financial support from my organization. You do need workers' union representatives who have a rights-based understanding of what are the employer's rights. You do need that kind of expertise. You do need someone in recovery. So we make sure that we do have a peer, someone who's gone through treatment within the institution and is in recovery, can serve as a very good champion for alcohol and drug abuse issues. And then we do need a HR representative. Remember, we also deal with HR-related issues like job promotion, discrimination in the workplace, potentially termination of fitness to serve, disciplinary issues. So you need someone with HR related background as well. You need someone from occupational health and safety. So Madam President, if you want details, NACADA also has guidelines for how to develop a workplace policy on alcohol and drug abuse, and they have detailed in it all of the different cadres that are there. But organizations should not feel that they can't constitute a committee because they don't have all these cadres. I do realize that organizations are at different levels of development. Some are really, really young with very few employees, and some are really, really well established with well differentiated departments. So do not feel discouraged. Whatever you have, start with it, even if it's just a psychologist and a human resource person, go for it.
Thank you very much for that response. So clearly, we need to be deliberate on who becomes a member of this particular committee. But I'm also looking at a scenario that we are looking at organizations that do not have social workers, do not have psychologists, do not have all these professionals within the mental health space. What advice would you give them?
Yeah, that's a really good question. So certain organizations, I might not know their names off the top of my head, do offer EAP services to organizations. So an organization can sort of outsource and pay for another, organization to deliver EAP services for them. So I do know maybe 1 or 2 NGOs in Nairobi, I can't remember their names. They offer EAP services to institutions that don't have the kind of membership that we do have here where I work. So outsourcing.
Great, just showing us what is the space of EAP. It doesn't have to be institutionals, but organization can subcontract from outside to professionals that are actually doing this. ISSUP being in the space of capacity building, I also feel that there is opportunity to capacity build in terms of equipping the committee members with basic skills in terms of what their roles and responsibilities entail. Thank you for that response. We have another question of in our country at times, especially amongst the civil service, a question has come through. Sometimes people are dismissed or they are suspended when they are found to have drug and substance use problem. So the person that is asking ask which one should come first? Is it the interdiction or is it a referral to treatment? What is the right way in which organizations can be able to address workplace related drug and substance abuse problems?
Yeah, really good question, asked all the time. We are saying that substance use disorders and substance use health problem. So preference by far should be given to referral to treatment. I can tell you when someone is addicted and you interdict, then what happens? Because they are unwell, they're trying to stop, but they can't. They're addicted to the drug. It's a health condition. Let people be sent to treatment. This is what we are saying. By far, let sending for treatment take precedence over whatever disciplinary action may be done. Because once you interdict, then it's not useful. It's not useful. What's the point? It's not useful.
Mm-hmm. All right. Thank you for that response. As part of the things that you have said employers can do in managing alcohol and drug abuse, in some settings, they may have issues to do with screening and drug testing. But there are times that there comes a delicate balance between the screening and employees probably feeling they are being discriminated, they are being profiled. What recommendations would you give to such institutions that by the nature of their work is very sensitive and the issue of drug and substance abuse is critical to ensure that no accidents or there are no major mistakes done? How can organizations that want to introduce screening as part of the mitigation maintain that delicate balance and without having employees feel like they're being profiled or discriminated?
Okay. So I think that the first thing I'd like to emphasize is that there are two interests here. There's the interest of the employee, but then there's the interest of the organization that unfortunately we cannot wish away. So the mandate of the Employee Assistance Program is to bring together those two interests somehow. This is what I see. In certain high-risk jobs, it is important to test because of the safety issues that may be posed. And I'd like to pose this question back to the audience or give them scenarios. Who would want to be in a flight with an intoxicated pilot or who would want to be in theater with an intoxicated doctor? So that is it, you know, that you want to uphold the rights of autonomy for the employee, their rights to make decisions. But on the other hand, as an organization, you have the responsibility to safeguard the lives of others, so that the rights of this employee who's intoxicated are just the same as the rights of these passengers in this aeroplane or this patient who is in theater. And so it's always a tight balance. So this is what we've done in my institution. To balance that out, we've said that people should consent to testing. Okay? And if you decline, it's fine. You should consent to testing. If you decline, it's fine. So we don't force. However, we have said it will be mandated for certain high-risk situations where that consent will be waived in the interest of the people that we serve, because we have to consider both interests, and it's always a balance, you know. So we are saying you consent, but if we feel that the situation is high risk, for example, a driver to an ambulance, you understand, or a doctor going to a theater, then that can be waived. So it's a balance. Both the interests of the employee and of the organization has to be considered. And it also helps to communicate this upfront to the employees. Educate them on the contents of your policy, tell them what to expect, you know, if they presented to work intoxicated. That way, the day they know they're intoxicated, then they are not coming to work, for example. So we are saying that employees also have responsibilities that they need to fulfill. For example, I know I'm intoxicated, then I don't come to work. So tough, but both interests have to be balanced.
Wonderful. That equally the employer has a right as much as the employee has a right. Another question here comes in. I think your presentation on EAP and the need to have it has made people want to have it in the organizations. And someone is asking, so what are the key competencies if you're working in an organization as the EAP in charge? What competencies should one have, and what are the challenges? I know when you're giving us examples of the constituents of the committee, some of the responsibilities may be well outlined there, but maybe you can just take us through as an implementer of an EAP program. What areas, what skills, what knowledge do you need to have? And what are some of the possible challenges should people expect in the implementation of EAP? Because one thing you said that there's need to educate the supervisors, they need to have a buy-in. What should people really expect, and what implementation activity should be there?
So about the skills, or you need passion. You need that passion to keep you going. I laugh because you need that passion, you know, to keep you going, because it can be tough. You know, you need to keep at it. You need the technical knowledge on alcohol and drug use. So it's helpful if you're an addiction professional or mental health provider, because you do need that technical knowledge. But also you do need, you know, other soft aspects like passion, like advocacy skills, like just being tireless and persistent, you know, that will keep you going. The ability to bounce back from frustration, because it can be really frustrating sometimes. So you need the technical skills, but you also do need these other soft skills. But if I was to rate all these skills, I would just say that passion is at the top. You really do need to want to work with employees with alcohol and drug abuse issues. It has to be something that really lights a fire inside you.
All right.
Some of the challenges we face, I think The greatest challenge, again, I speak from my experience, is the relapse rates are quite high after taking patients through really specialist care, specialist outpatient care and inpatient care. The outcomes are not too good, and I don't think that that's just here in my organization. Generally, substance use disorders, especially severe, then the relapse rates are quite high. So I'd say that's been my greatest challenge. Some of my greatest wins and joys, very high level support from management of where I work in terms of the EAP program and in terms of just general alcohol and drug abuse management.
All right. Thank you for that. And you've touched a bit on the relapse as part of the challenges. There's a question here. What if the workplace is the sole reason why somebody is relapsing? At what place does the workplace get integrated into person's treatment? In your presentation, you gave a case example where somebody was redeployed to another department that was not a risk factor to this particular person. But what would be the recommendation or advice, so to speak, that you can give to employers as part of recovery support, as part of the reintegration back after this person has been referred to a rehab and they have come back to the workplace?
Okay. That's a good question. First of all, a comment about the workplace being the sole contributor. Generally, with substance use, what I've seen is that there's multiple things go into it, multiple things cause it to happen, cause for someone to experience a substance use disorder or to experience a relapse. It's hardly that it's one particular thing, but nonetheless, I think I talked about how we can make the work environment supportive of mental health issues. For example, we advocate for non-discrimination post-rehabilitation, so that, even if redeployment happens, but you're within sort of the same job group, the same level, we do educate supervisors and managers to support employees who've come from rehab. We implement programs to support recovery. Like recently, we held a half-day workshop for staff who are in recovery with their spouses, and we took them through a bit of health education, but also group psychotherapy. We want families to understand how they can play an important role in supporting staff. Also, to prevent relapse, we do have phone call reminders. Please show up for your clinic. We do have an outpatient service, post-inpatient care. So we run that weekly, and we make sure that we follow people, almost weekly for 1 year after inpatient treatment. So just, generally making sure the work environment is supportive, but we also do implement, follow-up services at least for 1 year. And we do see that people who complete the 1 year follow-up do well in terms of outcomes.
Thank you so much. So encouraging organization to provide additional support in addition to the rehabilitation that people get. We are come to this our top of the hour, but I have a question on my own. Coming from the healthcare sector, most cases, the general population tend to assume that people in the spaces of healthcare are okay, but they are also quite heavily affected by issues of drug and substance abuse, and you're coming from such a setting. What kind of recommendations, special recommendations that are unique to the healthcare professionals, as you mentioned in the beginning, would you really give so that people can be able to address the issue of alcohol and drug use among the healthcare workers and in their different workspaces?
Yeah, what you say is right. We did a study during COVID-19, and we found that about 40% of healthcare workers at that time had harmful alcohol use. And a couple of other studies have been done, and you can see significant problems among healthcare workers with alcohol use. So the interventions that I've talked about here really do apply to the healthcare setting. One unique aspect that I find with healthcare workers is that they are so giving of their time and of themselves, and they put everyone first before everyone else. They don't pay attention to their physical health. They don't pay attention to their, wellness. And there's a culture of stoicism, being a hero and being stoic and not accepting vulnerability. So we make sure as a committee, when we talk to healthcare workers, we do emphasize the need that the carer also needs to take care of themselves, that they need to set aside time to take care of their mental wellness. They need to accept vulnerability, which is very tough for healthcare workers to do, because they are the heroes. They are the ones who make everyone else well. How can I accept that I'm unwell or I'm struggling with alcohol and drug abuse? So we do encourage, as that's the special thing that we do for healthcare workers, is to encourage them to accept vulnerability and to seek help. But the programs are largely the same as the ones that I've talked about earlier.
Well, thank you, Dr. Florence. Thank you, ladies and gentlemen, for your questions. There are more that are still coming, but we may not be able to read most of them. Some have been responded in the chat. Thank you for participating in this webinar, for the insights gained. The knowledge is not for us to keep. Thank you, ISSUP Global, for always being gracious and according us the platform to be able to sensitize more people in matters SUD. And remember, you will be able to receive your certificate on your email. The session was recorded. You'll also be able to get the presentation, as well as you can be able to access this on the ISSUP YouTube channel. For those that are not ISSUP members, kindly sign up, connect to the local ISSUP program that is available in your country. For the ISSUP Kenya members, also join with us. We need more of us in addressing the issue of drug and substance abuse. We meet here again in July. Watch out for the next webinar. So thank you very much. Have a good night, have a good morning, have a good evening.
Thank you.